Assalamu alaikum. Welcome everyone. Today I want to discuss about neurogenic bladder. This is the condition is caused as a result of some type of problem with nerves whose function is to control the bladder. Neurogenic bladder, a bladder dysfunction stemming from the neurological damage that cause the flaccid or spastic bladder dysfunction. In bladder, the trigone is responsible for contraction of the bladder to pass the urine through urethra. There is sphincter, internal sphincter and external urethral sphincter. Three layers of bladder, outer, loose connective tissue, middle layer smooth muscle and elastic fiber, inner layer transitional epithelium. The innervation of urinary bladder, pudendal nerve, sacral 2, 3, 4, enter through the posterior rami and terminate the anterolateral column. Sympathetic, thoracic 10, 11, 12, lumbar 1, 2. Hypogastric plex enter through posterior rami and terminate the anteromediolateral column. Efferent innervation, parasympathetic, sacral 2, 4, pelvic plexus, pelvic nerve originate, cholinergic, postganglionic fiber, bladder and sphincter. And sympathetic T10 to L2, hypogastric or pelvic plexus, noradrenergic postganglionic fiber, smooth muscles of the bladder base, internal sphincter, proximal urethra. And somatic pudendal nerve, ventral rami, external sphincter. So neurogenic bladder is the name given due to number of urinary condition in people who lack of bladder control due to brain, spinal cord or nerve problem. In the brain, signal from the brain. Any spinal injury, the signal not go to the urinary bladder. So not to signal do not get through to the bladder as sphincter. Cerebral cortex masses a full or empty bladder. And pontine micturition center will switch between the filling, storage or voiding. And pudendal nerve, somatic or voluntary control. This how to modify our lifestyle. In the neurogenic bladder, delayed voiding, scheduled voiding, pelvic floor exercise, bladder dietary change. And drugs and catheter, intermittent clean, intermittent catheter through the urine parts. And continuous type also surgery, artificial sphincter, urinary diversion, bladder augmentation, sphincter resection, sphincterotomy, and sacral neuromodulation, percutaneous tibial nerve, the sympathetic nerve, parasympathetic nerve is 2 S4, and pudendal nerve, the somatic control. If the symptomatic urinary tract infection, fever, urine leak, and discomfort, bladder pain, spasticity, autonomic diversion, dysreflexia, chill, so need blood culture and antibiotic. And due to the central nervous system disorder, Alzheimer's disease, dementia, Lewy body, multiple cerebral infarction, detrusor overactivity, neurogenic bladder dysfunction, anticholinergic drug use with caution. Alzheimer's disease also produce neurogenic bladder. Above the spinal, if an injury and below the sacral, any injury and their neurogenic bladder develop. Cerebrovascular accident, Parkinson disease, brain injury, hydrocephalus, traumatic spinal cord injury, non-traumatic spinal cord injury, congenital neural tube defect, vertebral disc protrusion, fracture of the spine, multiple sclerosis, diabetes, mellitus, neurosyphilis, herpes simplex, herpes zoster, Lyme disease produce the neurogenic bladder. The neurogenic bladder is X-ray bladder, hugely distended, large atonic smooth walled bladder, hypertrophic type of bladder, and caudal regression syndrome here due to lesion of the spinal cord, peripheral nerve, control of micturition of a lower motor neuron lesion, perhaps dorsally demyelinating lesion of the spinal cord, myelodysplasia, diabetes, extensive pelvic operation, and hypertrophy type regard the neurological induced bladder outflow obstruction. In this case, bladder is small volume, thick wall, prostate triangulated wall, show marked circulation. Thank you for listening.